I'm Peter Block in Orlando at the AHA annual meeting for On the Scene, and with me is Geeta Gulati from, believe it or not, Norway. She doesn't look Norwegian, but is, and she has a very interesting study concerning chemotherapy and breast cancer and left ventricular dysfunction, a very important issue clinically. So Geeta, let's cut to the chase here. Tell me about your study.
Well, this was a study on how to prevent chemotherapy-induced cardiotoxicity in breast cancer patients. So we did a 2x2 factorial design, which was randomized, placebo-controlled, and double-blinded in the breast cancer population in Norway.
Okay, now the two drugs that you used were?
Candesartan and metoprolol.
Okay, so candesartan in one group, metoprolol in the next, a combination of the two in the third, and placebo on the fourth.
That's correct.
Short version of this, what did you find?
Well, we found that candesartan actually had an effect on the decline of left ventricular ejection fraction.
Wow, that's impressive. Tell me a little bit about the combination therapy and tell me whether metoprolol did anything at all. I mean, these are patients who had diminution in left ventricular dysfunction. Is that correct?
That's correct. So there was no interaction between candesartan and metoprolol, and there was no effect in the metoprolol group.
Okay, so I guess the next question is, if I were a clinician taking care of a woman who is having chemotherapy for breast cancer, should I at this point say, this is clearly a plus for candesartan, I need to put my patient right on that at this point?
I wish it was that easy, but it's not that easy because what we found was just after the chemotherapy. So we did the last evaluation after the chemotherapy. So the long-term implication we don't know. So we are doing a follow-up study to see where this goes.
Okay, but clearly left ventricular dysfunction was aided by candesartan. When did you start the drug in terms of when the chemotherapy began?
We started the drug after the baseline evaluation of the patients, but before initiation of chemotherapy. And then they were on the drugs as long as they had the chemotherapy and then until the last evaluation.
Okay, do you anticipate doing a longer trial?
Yes, we do. We are already doing the follow-up.
All right, so for all the folks out there taking care of breast cancer patients on chemotherapy, it sounds to me like candesartan started at the time of their chemotherapy, not afterwards, right?
Not after.
Started at the time of their chemotherapy is a good take-home lessons from this. Thank you so much, Geeta. Great.
Thank you.